S-Cleans and SCM. Whenever we have a patient with neck pain or a complex case with neck pain, shoulder pain or elbow pain that we are suspecting that is coming from the neck, all this different stuff, we're gonna focus on, apart from the treatment down the arm, we're gonna do some work here at the front of the neck. Here we have the SCM from the chest bone going all the way up into the mastoid process, and there a bit below that we have the different levels of the cervical spine. The scalene is going to be approximately, to keep it simple, you're going to put your hand there, and that's covering the anterior and the medial scalene. The posterior scalene, for palpating that properly, you need to rotate a bit towards, to the same side, and there you're going to palpate it at the back. So, to keep it simple, you're going to put your hand there, you're going to try to find the nerve root or the attachment of the muscle. So this is the transverse process of the cervical spine, and once you're there, you're going to press, and you're pressing down, and at the same time a bit towards the chest bone. Just keep in mind that the SCM is immediately above the level of where I am pressing. So that's the SCM. I am getting inside there, and I am pressing a bit down and a bit towards the chest bone. So that's gonna create some referral on the front of the shoulder, here on the trap, because we are in C2, C3, maybe C4. If you go a bit lower, you're gonna get into the arm because you are pressing like other nerves there, other levels there. Is that going a bit to the biceps?
It's actually, yeah, here.
So it depends on the person. Sometimes you need to go a bit deeper, sometimes you need to go a bit more to the side. In the case of Patty, I think that this is going to create more like a general referral from there.
It's quite intense around here, actually.
Around there.
Yeah.
Every single person is different. You need to find a way. The way of treating this, or to making this area, instead of just rubbing like that is extremely uncomfortable, it's much better to ask the person to move the arm on the top of this pressure. So elbow straight, Patty, and from there you're going to bring the arm as close as possible to the body, if you don't mind. Great. Bring the arm all the way up, just try to touch my head, elbow straight, elbow straight, elbow straight, and down. Most patients are going to feel like the arm super heavy, kind of almost dead, pins and needles, and just like simply, especially from this range of motion, they're going to feel that they are not in control of the arm, something like that. Keep going, go, 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 and all the way down. Try to move a bit from the outside to the inside, and just always double check if the patient needs to rest, because this technique could be very, very intense. And after that, just relax, and that's all.